I'm Dr. Karl Clark. I'm the president and CEO of the Mental Health Center of Denver. And on behalf of my board of directors and my staff, thanks for coming. We've got some pretty cool things going on that you're going to hear about tonight. So we decided that we wanted to be in the most innovative place on the planet, and that's why we're here at Catalyst. So it's my pleasure to introduce Mike Viselli, who's going to tell you about what this place is all about.
Many of you in this community made this campus reality. So what are you sitting in today? Again, a dream of mine almost 6 years ago. Through my whole history of being in healthcare since I hung up the college and professional football cleats, I recognized being in healthcare all those years how fundamentally broken it is and how many silos there are. And I said, gosh, if we could just work together, imagine what we could create. And so I said I didn't want to build a building with just startups because this industry is too complex. We got to have everybody in the same boat, from the giants to that woman with an idea on a napkin, to associations, academic partners. Brace yourselves, ladies and gentlemen. We need to even have the patient involved. Wild, I know, wild. So what you're sitting in today, I believe, is the first in kind in this country. And I will throw the bet out to all of you. If you can point to me another asset like this in the United States, I will buy you the finest dinner in Denver, Colorado. This is how many dinners I have bought so far. We have brought together payers, providers, academic institutions, associations, 60-plus startups, all working together every single day. We call this an industry integrator, bringing all aspects of healthcare at the point of innovation together under one roof with one goal in mind: to reimagine health, wellness, and healthcare for our city, for our state, for the citizens of this incredible state, and for our country. I'm so thrilled and honored to have you here, but most importantly, some of you may or may not know, I'm incredibly thankful to Dr. Clark's leadership, to Wes Williams' leadership, and to let all of you know, if you don't know, that the Mental Health Center of Denver has opened up their first ever innovation lab right here on campus. And I know I'm a touch over, but I own the place, so bear with me. I just got back from a sabbatical, my first ever in my career. I took a month off and went to Asia. And on the front end of that sabbatical, one of our community members had a family member that committed suicide. And within 48 hours of landing back here in Denver from Hong Kong, my dearly beloved neighbor committed suicide. The front end and the back end of a time that should have been some of the happiest in my life. We are staring down a crisis in this country. And it is up to us and this city and all of you leaders in this room to start working together to demystify this crisis. There is nothing to be ashamed. We should celebrate mental well-being. And with Mental Health Center of Denver's leadership here on campus, and with my deep commitment to them, I'm very confident we're going to get there. Have a great night tonight. We have an incredible lineup. I'm honored that all of you are here. Come back soon, come back often, and jump in the boat with us. Have a great night.
So let me talk a little bit about a couple of things. And one thing is, this kind of event just doesn't happen by accident. There were a lot of people involved in it. And that includes the people that sponsored us. So I want to thank the sponsors that helped us. Citywide Bank. I have to tell you about Citywide Bank. They have been devoted to helping mental health in all of our communities for many, many years, and they were the only bank that believed in us 20 years ago when we had 4 days cash on hand. But they did believe that we had a good idea, and they believed in our management team to try to make things better. The second is My Strengths. My Strengths is the health club for the mind. If you go on our website, under resources, you'll find My Strength. And this is a place where they have adult online learning to help with all kinds of things, help with stress, help with learning how to sleep better, help with anxiety, depression, addiction, pain control. And if you want a 24/7 place where you can go and learn the best in the science, that's My Strength. And the last group that sponsored us is Flexential. Now, this group keeps changing their name, which irritates me a little bit. But what they are is they're our cloud provider. And if you are a heavy data user type of cloud or organization, they will help you turn a cloud from a liability to an asset by helping you deal with your data better, get to market faster, and do things in an innovative way. So let's please thank them for helping us out. So I also want to thank the host committee. If you guys would stand up, these are the folks that kind of helped design this whole well-being experience. Would you stand, please? Maybe they're all standing in the back. No. Great. So, and do we have any elected officials here? There they are. Yeah. So, so at the Mental Health Center of Denver, our mission is enriching lives and minds by focusing on strengths and well-being. So we focus on what people can do, not what they can't do. And we know everybody has natural strengths that they bring to any sort of encounter. So our goal is to really help people get to where they want to be in life. And tonight we're here to talk about innovation and the challenges and why we need innovation to do even more of our work. Currently, we touch the lives of about 90,000 people, and it's all ages from young children to the elderly. And our goal is to improve the well-being of every single person that lives in Denver. So we're seeing 90,000. That means we've got a gap with the rest of the 700,000 that live in Denver. So that's why we're going to need help. We only have so many providers, and how do we leverage those providers to do extraordinary things? Now, some people ask, well, what is it that you actually do? And what we do is 3 different things. We do somatic treatments. Those are things that we do with the body. And that's everything from medication, transcranial magnetic stimulation, to exercise, eating properly, sleeping well, all those things that influence the body to make the mind healthy. So that's one area. The second is psychotherapy, and that's all the things dealing with people's thoughts and feelings and behaviors to help them sort of sort through things to get in a healthier state. And well-being is not the absence of illness. So well-being is that part of what we know goes right with the brain. So we incorporate those things that go right with the brain in the work that we do. So those of you that experience meditation tonight, those are examples of things that actually create neurogenesis, where you have cell growth in the brain, and we find those things helpful. The last thing we focus on is the social determinants of health. And these are all those things that actually are outside of the clinical work that really make a significant difference in people's overall well-being and health. So those are things like affordable housing, going back to work, going back to school, those things that have a bigger impact on health than any kind of clinical work, whether it's mental health work or some other field of medicine. So let's talk about well-being for a second. So it's interesting that your well-being has an impact on everyone around you. So the better your well-being is, the better it is for your family and your friends and anybody you interact with. So we know the science of well-being, and a part what we have learned is that the science tells us things like, if you have a friend whose well-being is good, it has a 15% influence on your well-being to the positive. If you have a friend who has a friend whose well-being is good and you don't even know them, it has a 6% influence on your well-being. And it goes the opposite way too. So if you have a friend whose well-being is not good, the numbers aren't the same, but it's a 6% influence on your well-being to the negative. So in fact, the better our well-being is, it has a ripple effect in the community, that we're all much more connected. And all the wisdom traditions in the world have said that we're all connected, but sometimes we forget that. The science is saying the better your well-being, the better it is for everyone. So let's talk a little bit about what we're here to do tonight. So a part of it is how do we improve, this is going the wrong way, sorry. So how do we improve by innovation? So there's really two types of innovation. So one type is where you do something incremental to make things better. That's a type of innovation. The other type is where you bring in something brand new to create innovation. And it's not like one is better than the other. They both can have tremendous impacts. Just like when water turns to ice. It's a small incremental change in temperature, but it has a phase effect, a profound effect. So we'll talk about a couple of innovations. One of the innovations that we have is our co-responder program. So it has been the history of probably every city where there's interactions between police officers and people on the streets, where the real issue was a behavioral health issue. It was either a mental illness or an addiction problem. Yet most of those people, when the police would interact with them, would wind up in jail. So our co-responder program actually has licensed social workers going out with police officers on calls where they think there's a behavioral health issue. And it's been remarkable. In the past, 97% of those folks would have gone to jail. Now only 4% go to jail, and the rest of them are getting the treatment services that they need. So I am a psychiatrist, and I still see people on Tuesdays. I saw people this morning. This is my Tuesday morning clinic. And there's this thing that has happened in healthcare for a long time where I'm seeing somebody and then another provider is seeing that same person, and somehow we have to exchange information to figure out how we can coordinate care. And the way it used to go would be like this. With the advent of the electronic record, if I was seeing somebody and they were also being seen by Denver Health, I would go into this program called EpiCare. So I've got my electronic health record, I go into EpiCare, I log in, and then I have to verify that I logged in. And then I have to get to a screen asking what I want to see. And then I had to search around for what it was I was looking for with their electronic health record that I don't even know. So our IT team came up with, Wes, help me get this right. Care equality. So here's what the team did. It took them a year to do this. So they spend a year trying to figure out how to make that easier for a psychiatrist like myself. They train us on Monday, and on Tuesday, I am now in our electronic health record, which happens to be Avatar. It's done by NetSmart, and I'm in that record, and I'm seeing somebody that I've seen for a long time, a man with schizophrenia. And we had this really bizarre thing happen in our country. We ran out of a medication that is very, very common. It's called Artane, trihexyphenidyl. And this medicine is for side effects. So when you run out and you don't have it, and there's not any in the country, you have to replace it with something else. So I had replaced it with Cogentin, which is another medicine for side effects. So I start this guy on it. He happens to live in a board and care facility, and he got this acute pain in his arm. He goes down to Denver Health. They check him out. He's now in my office saying, Doc, you know, they told me I've got something wrong with my arm, but I know it's that cogentin that you gave me. Now, I know this guy, I know him well, right? So my very first person, I click on the button that took me right into Denver's health record, right to the episode that he was talking about. And I could say, wow, look here, you had, you've got this clot. They did an MRI. You've got this small clot in a vein right here. Oh, well, yeah, they told me that, but I didn't believe them because I don't know them. Do you see what I mean? And so in that one moment, we took what would have taken weeks to figure out and figured it out right on the spot. That's innovation. So just one other thing to say, which is when I say mental health, people think mental illness. Isn't it interesting? Mental health. We all have mental health. Like, right, we're somewhere on the continuum with mental health. Some of us are doing just fine. Some people are thriving. Some people are having the ups and downs of life. Sometimes those get to the point where it creates an illness. And the interesting thing is most people will recover from their illness. So it's not an us and them, it's an us. And later I'm going to invite you to learn more about the science of well-being. But at this point, I'm going to introduce our panel, if you guys would like to come up. I don't know how you're going to get up here. There's stairs over here. Then you squeeze by, jump up. So this is about imagining the future and using innovation to get there. The future that we want, not the future that we don't. So I'm going to introduce each person and I'll let them tell a little bit about themselves and what's on their mind. So Wes Williams is with the Mental Health Center of Denver. And Kerry Pye Coats is from the Office of E-Health Innovation with the state. KP Yapala is with, I can't read, Access Mobile. And then we have Debbie Belt? Yep. Yeah, with the Innovation Center at Anschutz campus. So I'm going to let you guys go for it.
Well, great, thanks. Hi everyone, I'm Wes Williams. I am the Chief Information Officer at the Mental Health Center of Denver. I've worked with Karl here for the last 11 years, the last 4 in the role of CIO. And I'm really excited about sort of what we're doing now at work, right? I've been the CIO the last 4 years. We did a whole bunch of projects, some of which were exciting, some of which were super boring, right? Like all of which had to be done. And I've got this great team at the organization that, helps me look good, helps Karl look good. We've cultivated partners over time. That whole sort of anecdote around care equality, like my team, I did a little tiny bit of work. My team did more work. The folks at NetSmart, and we have a couple guests there, they're our electronic health record, but Tom Herzog's their Chief Operating Officer, Tracy Roxby is their GM for the West, and they're here tonight. They actually did the lion's share of the work on our end to make that happen. And so I think the reason I would say that is that I think that collaboration is a big part of innovation, right? And having clever ideas is not enough to get this work done. I think I'm sort of uniquely positioned to have clever ideas, right, around behavioral health innovation because I have a background as a clinical psychologist, right? I moved to Colorado a while ago, we'll just say, to study clinical psychology at the University of Colorado at Boulder. I studied trauma and juvenile delinquents there and thinking about how trauma impacts people's narrative understanding of themselves, right? And then went into practice and found that although trauma was really sort of interesting, it was also really hard to do that work, right? And to sort of be working with traumatized people, right? And I considered, do I want to go into private practice, and take sort of ADHD patients and, make a life for myself that way? Or do I want to see what kind of impact I could have? And it also is true that I was terrible at clinical documentation, right? Like as a provider, like it was so hard. And I'm kind of a system guy, right? So I was constantly sort of experimenting with like, how can I make this easier for myself, right? I don't know that I came up with something, but that got me invited onto the clinical committee at Mental Health Partners, which is the community mental health center in Boulder, right? To help stand up their first electronic medical record. So first it was just sort of making recommendations. We need it this way, we need it that way. And then, I had this notion of, you know what? I think I could do this myself. Like, I think I could personally set up this electronic medical record. And so I sort of took a step away from clinical practice, informed maybe by the fact that I was not sort of emotionally cut out to work with the traumatized populations I felt it was so important to serve, right? And 13, 14 years ago, started working on health information technology, right? And so that journey has taken me here to this point, and I think it is sort of finally making sense for me, right? Finally making sense of like, why did I study psychology and like put 8 years in at grad school? I was not the fastest student, right? 8 years in at grad school to then go into IT when I took one computer science course, right? Like, but like now it's all coming together, and I see here the vision of like this work I've been doing the last decade plus can now help drive change in clinical care, right? And that to me is exciting, and it's exciting that like the work we're doing here in Denver is helping make the place where I'm raising my kids a better place to live.
Thanks. Debbie?
Hi everyone, I'm Debbie Belt. I am inspired by Wes's story because I like to call myself a rogue psychologist. So I have a background in clinical psychology, actually in disruptive behaviors, so working with kids, and for years spent time working in behavioral genetics and then got into genomics, and then that led me to digital health, but I was working in that more around cardiovascular disease and neurodegenerative diseases, and feeling very frustrated by the fact that I saw use cases around mental health and around behavior tracking and ways that we could leverage technology to really improve our well-being. And so was that annoying token psychologist at a startup being like, hey, we should do it this way. Hey, have we asked what their motivations are and what their values are, and instead of just giving them genetic data back. And so became pretty frustrated with that, and then had this option of do I go clinical or do I go back to academia? Went back to academia and was really excited to hear other people talk about the importance of behavior change and understanding values, and then was like, but wait, as we worked on technology, can we add this in, and can we do this, and can we do that? And everyone's like, no, there's no budget, right? And so I was banging my head against the wall again, and then discovered the group down in Anschutz, the National Mental Health Innovation Center, and joined there a little over a year ago. And I'm finally able to bring both of my worlds together, because I spent a lot of time looking at technology, understanding how it could be used for mental health, could be used for just even communication between me and a client and those types of things, and really tracking behaviors, because a lot of times we have that recency effect, and so we'll remember the worst thing that just happened to us versus the whole week. And so joined the National Mental Health Innovation Center, which was founded by Matt Vogel and Peggy Hill, with the intent to approach and understand new innovations around mental health and mental health prevention and intervention. And then in that process, I've been able to be part of helping develop a new model around bringing technology into community sites. And so we've developed what we call the Tech Innovation Network, and through that, we've been able to bring together tech partners who are interested in getting into mental health. Some of you probably saw a few of them tonight demoing some of their content. And so that ranges from apps and platforms to virtual reality. And we provide guidance at our center around just clinical subject matter expertise, research expertise, and through that process, we've been connecting with community partners such as MHCD and different groups that are the early adopters and are interested in this innovation and bringing in technology. And it's been really exciting because we're able to help form the technology that's built versus waiting until someone builds the technology they think you want and then plop it in front of you and then it falls flat because, oh, it doesn't work with our workflow. I mean, even just kind of the logistical matters, whether or not the content's even evidence-based. So that's something that's really important to us. And I guess thinking about the impact of this, I had ran a group over the past year for mindfulness-based cognitive therapy for ICU nurses who are at risk for burnout, which most of them were experiencing burnout when I was doing the group with them. And it was really hard because mindfulness is a huge component of that, and for them to slow down and actually take a break during the day and try to sit and have a moment was really hard. And I kept sitting there thinking, well, I know about this thing called virtual reality, and we're using it across the street, and really wanting to tell them about it, but also realizing I didn't want to mess up an entire randomized control trial. But realizing that I constantly, in my clinical work, have come across situations where technology can help augment existing treatments and programs and protocols. And there's so many places that this can happen. And so we've been working with a lot of community partners, mental health centers, the university, primary care, Department of Corrections, higher ed, just bringing in technology. One example I'll just share is that around kind of our TIN, our Tech Innovation Network, we really wanted to go in without a hypothesis. We want to understand the organization and where their needs are and how technology could fit in us understanding the landscape of that. And so we were going in and talking to a lot of different groups, and one of the places we started with was mindfulness in a VR headset. And so we would sit and talk about, different barriers and things that they want to focus on. And then we would go in and train and show them how to use the headset. And we'd be like, okay, who do you want to start with? Which patients or clients do you want to start with? And all of them would turn and look at us and be like, well, can we use it? And so we had this moment of realizing, had we gone in with this more direct goal of this is how you use it with a patient and this is what you do, we would have had a huge missed opportunity there. And so we've actually started with staff wellness, which helps a lot because then they're comfortable and familiar with the technology in and of itself. One last thing I'll share before I pass the torch is, another place where being flexible and realizing that VR can be used in so many different ways along with other tech. There was one group that we're working with where they had a patient who was in a situation where they would never see their pet again, which was a cat. And they were pretty depressed and also stuck in the hospital. And so one day they gave them the VR headset and they said, oh, well, do you want to do a meditation? And this person said, no, I don't want anything to do with that. And then said, wait a second, can I see cats? And so they were able to pull up a 360 video of cats playing, and they were able to put this headset on and wear it and just be able to experience cats playing around them, and took the headset off and said, this is the best I've felt since I've been here. And so I think that just us being open to how technology can fit, there's just so many ways, and I'm just excited to be here and to be around so many people who are at the forefront of this. Thanks.
Thank you. Kerry?
Hi. So I'm Kerry Pye Coats with the Office of eHealth Innovation, and I'm the State Health IT Coordinator and Interim Director of the office. I think if I had a virtual headset with cats, it would articulate what I do day to day, a lot of herding cats, and I hope the cats are getting along and not scratching the furniture and they're playing nice together. So, but I will say I got a chance to try the virtual reality over there, and watching the leaves fall and the sun ray, it was just phenomenal. In our busy kind of day to day, it was just a nice way to kind of take a step aside and remind myself of the importance of meditation, mental health. So thank you for that, and thanks for having me here. So one of the things, or a few of the things that I'll mention, a little bit about my background, to give you a personal story, and then I'm here to kind of share about the roadmap, our health IT roadmap, our current administration, and how you can get involved. So my background, I'm dropout medical student, didn't make that happen, but I always wanted to help people, and so I worked in organ and tissue donation for a long time and saw firsthand kind of the consequences of suicide, traumatic school shootings, and really was just wanting to do more. So I ended up going back to grad school. I have a master's in health administration and master's in science and sustainability, and through that graduate programs, I got to make some really great connection and kind of got into the world of health IT. At the time, I worked for a startup called the Breakaway Group, and we focused on what could we do with clinicians to get them up to speed on their electronic health records in a quick and timely way. And our founder formerly worked for aerospace, and during the time they were going from digital or from analog to digital. So if you can imagine pilots that fly our airplanes, it's all kind of automated now, but they had a process of training their pilots. And so they took simulations. So if you've ever played video games, it's those aviation simulations. So we took that and applied that to healthcare, specifically electronic health records. And so it was a great kind of way to connect clinicians to their workflow and make it more digestible. So many years later, I saw an opportunity with the Hickenlooper administration to get involved and to be able to be the champion of health IT for Colorado. So about 3 years ago, jumped in, kind of feet first, first time in government. So I've learned a lot, and they're learning a lot from me. And so the Office of eHealth Innovation, where I work now, it reports to the Lieutenant Governor, who's also the director of the Office of Saving People Money, which is a really great name on healthcare, very specific, not just Geico, it's saving people money on healthcare. And we're really focused on ensuring, like democratizing data, at least in the office, and getting care to patients in a way that makes sense for them in a cost-effective, best health, best care. To guide the work, we have our eHealth Commission. It's a governor-appointed panel. I see some commissioners in the crowd, the Mark Lasso back there, and Wes Williams is also one of our eHealth commissioners, and they represent kind of a broad stake of leadership to not only advise our office, but to steer the work. And so I brought a couple, they wouldn't let me have PowerPoint slides. I'm like, come on, I work in government now. So I have some paper handouts. So I brought over there at the table our health IT roadmap, and this is a really great tool for innovators, entrepreneurs, patients, not so much, but for individuals who want to get involved and say, let's start doing more collaborating with Mental Health Center of Denver or across the state and focusing on, for example, care coordination, infrastructure investments. In rapid time, our office was able to get, with this roadmap and with the strategies, state funding, and we're in the process of getting our federal match to begin to start funding projects. There's a lot of things we could do, and before I wrap up, I just want to share care coordination was one of the initiatives that the community said we really need help with. We know that we've got 7 different Medicaid regions and health systems and innovators and entrepreneurs, but none of their systems are talking. So go fix that. And I was like, okay. So what are we going to do? So we've done an environmental scan, we've talked to stakeholders, and we've talked a lot about how can we leverage our health information exchanges in this process. But we're still kind of honing in. And one of the exciting things that we're doing to hone in on where we head and where we fund projects is, brought some handouts, but 10-10-10 did their 10 days, 10 entrepreneurs, and 10 wicked problems. And they use their methodology to kind of hone in on what are those complexities in the system and where can we really focus as a government entity, private partners, public, and really look at. So we're first ever taking their process over the next several weeks and applying it to care coordination for whole person care. So it's not just the health system, because that's 20, even maybe even less than that, of what determines how healthy someone is. And really looking at a microcosm. We've selected Boulder because of some of the innovation investments that they've made, and are pulling in rural partners into this process to tease out, are there some areas that we can focus on infrastructure to align care coordination, and perhaps bring in other innovations such as virtual reality and e-consult and a few other things into that. But before we actually pull the trigger, we'll do that. So over the next couple of weeks, we're going to hone into that. But I think if you get a chance, the 10-10-10 process, even just mapping out, they have some really exciting maps that give you a sense of who's collaborating, what are the pain points, what are those opportunities that relate to mental health. So we've got childhood, mental and emotional distress, social isolation later in life, disjointed payment systems, and care coordination. So you have a starting spot. And then for OHI, our Office of eHealth Innovation, we're taking that and refining it even further, and we'll be sharing for Boulder as well as other counties where there's some other opportunities. Lastly, I'll mention our consumer engagement initiative. So you as the consumer are kind of one of the biggest drivers in innovation and access to your health, your mental health, and well-being. So we've received some state funding to begin to figure out how do we engage consumers and really empower them in their health. And the prior administration, Lieutenant Governor Donnellan thought, you know what, I think people want a portal for cost and quality of health information. And our office and our leadership decided, before we build another portal, because we have so many portals, let's figure out what people want. So we've been doing focus groups, hosting sessions. We just conducted a statewide survey. Over, I think, 4,000 people took the time out of their day to tell us about what are some reasons why they want to access health information, and do they even trust that information. So from there, we're going to hone into some specific projects that the state can fund, and we'll be looking for communities and partners like Mental Health Center of Denver to drive that work forward. So really excited, and there's lots of ways you can get involved with the office and help move things forward as a consumer, an innovator, entrepreneur, and even an advocate. So thank you.
Great, thanks so much for the opportunity. My name is Kapama Yalpala. I go by KP for short. So I'll start with a bit about myself and then what we're up to at Access Mobile and some of how we're interacting with this issue. So my family's from Ghana. I was born in Madison, Wisconsin, and I grew up in Northern California. So that basically sums me up. For me, the journey in healthcare actually started in African countries. So my extended family is in Ghana. I've spent a lot of time working in African countries around access to healthcare issues. And specifically, I was one of the early employees of President Clinton's foundation working on HIV/AIDS in East Africa. And what I observed when I was there, I lived there for about 5 years, working in places like Tanzania and Kenya, Rwanda, Uganda, is that everybody had a phone, but there was very limited access to healthcare infrastructure and services. That planted the seed for me. My wife and I both are public health practitioners. We met in public health school. My wife's a Denver native, and we moved here in 2010. And as we started thinking about how to improve access to care, we thought, well, everyone has access to a phone. There's not enough healthcare workers or infrastructure, so how could we use this tool to better improve access to health information and services? And that was the genesis of Access Mobile. So since 2011, we've been building a center of excellence in African countries, primarily in East Africa, also in South Africa, around how to use this little device to better connect people to their care needs. And the journey took an interesting turn for us, which was in late 2017, my investor started saying, well, KP, you're in Denver. And actually, if you look at the issues here in the US and in our communities, you find that a lot of the similar themes to what we're dealing with over there are here. And so we started to incubate the idea of how we could take lessons learned around connecting with people through their mobile device to better, to offer better opportunities for their care needs, and we brought it here to the US. And so what we're doing is we're focused on this concept of what we call intelligent mobile engagement. What we talk a lot about in Access Mobile is this idea of mass personalization. So with health reform here and the move towards the patient portal, what you realize is a lot of the communities that we need to reach are not on the portal, but a lot of them do have phones. Namely, I'm talking about Medicaid populations, I'm talking about people that are maybe at 200% of the federal poverty line, so they don't necessarily qualify for Medicaid. We have a hard time connecting with them in the health system. The phone is really a way to reach them. And so a few quick anecdotes. We work with Adventist Health White Memorial Hospital in LA. They serve a primarily Latinx population, all low income. But what they realized is everyone had a phone. And so they said, KP, can you help us curate with your team some strategies around how we send meaningful communication that not just informs but influences behavior, right? And that's kind of the intelligent part of our mobile engagement approach. And that really becomes a data challenge on the one hand. How do we get to know about you holistically from a data perspective? But then also it's about the care team, it's about a comprehensive model. So technology is just one of the tools in the toolbox, right? But you have case managers, you have community health workers, you have a bunch of people working around these individuals. And so technology is just the enabler, right? So we work with these populations around what type of communication or nudges can either get them to respond or get them to connect, get them to share information with us that otherwise we wouldn't have, that may not be in their record. And we found that what we run into as a digital health kind of innovation company is that all the silos that exist within the healthcare system that are blocking us from innovating are the same silos that block digital innovators from innovating. Because if I tell you that for me to understand a whole person so that I can send them meaningful information, that is beyond their clinical record. So if I've integrated with the health information exchange and I have that data, that's not enough for me to get to this concept of mass personalization. I need to know more regarding social determinants data, regarding other things going on in their life. And so even for us to fulfill this vision of communicating in meaningful ways to people, we have to have that whole picture. And I think for a lot of us in the digital health space, that is an opportunity for innovation, but it's not just a technological opportunity. It's actually about how we partner with other groups, right? And other stakeholders that are trying to influence that individual. The only other thing I want to add is so some of the work we do is also in rural America. So we are working now with a CCO in rural Oregon that's dealing with about 30,000 Medicaid lives. So I was just there last week looking at some very interesting data. So what we're trying to help this CCO with is they want to better engage their members so that they can improve their care and improve their access to services to drive better health outcomes, right? And what we looked at is we looked at emergency department data. And it was striking. What we saw was that in the 6 to 18 age category for emergency department visits, 40% of all visits were suicidal ideation. 4 out of 10 people between the ages of 6 to 18 were going to the emergency department with suicidal ideation. 18 to 30 age cohort, 20%. So that's something we need to discuss. That's something going on in this community. Mike alluded to it. This is going on all over America. And you ask yourself, like, someone going through that, a young person, this is the only place? Like, this is where they go? The emergency department? Okay. Then we saw something else interesting in the data. So when we were looking at older populations, because remember, all of this is about how do we better engage? So in this case, can we get better information to these people sooner, get them to services, keep them out of the ED, get them the mental health services? This is what we're trying to figure out. So then what we noticed is we looked at the data, and for elderly population, it was next to 0 in the ED. But elderly populations looked like what you would expect. So as populations got older, we saw that chest pain was the #1 reason for visit to the emergency department, which is correlated a bit more with what you would expect for an ED visit. But then the people working at the CCO said something very interesting. They said, KP, elderly people are committing suicide at astronomical rates in this community. It's just they're not going to the ED. So that wasn't showing up in the data. So really what we're looking at is an epidemic in that community. And this looks like many rural populations in the US. It's an issue we have in our urban areas across the board. And so I think that for those of us that are out there from the technology side, my only, if I could say one thing, it's just that it's not about technology alone. Like you have to look at what we talk about as mixed methods. So how do you integrate approaches? So how do you work with community health volunteers or health workers? How do you work with clinicians? How do you work with payers? But ultimately, how do you benefit people and looking at a whole person, not just someone that's a patient that came in with such and such at an ED on this date? And I'll stop there.
All right. So what we're going to do is I have some questions for the panel. And many of these questions actually came that people submitted ahead of time. If you have a question you'd like to ask, I've got a team in the back that'll look at your text message and get that up here to me also. For the panel, here's the rule. So, not everybody has to answer every question, right? If you have something to add, you can add. Otherwise, we'll assume that you agree with everything that's said unless you want to counter somebody, right? Okay, so no dittos. We're not playing that game. So how can technology help people live well as opposed to just be more productive?
That's a good question.
I'm a psychiatrist. I can tolerate very long pauses. I'm comfortable with that.
Awkward.
Yeah. You're here with two psychologists. How can help live well? Oh, can you repeat it?
Yeah,
please?
how can technology help people live well as opposed to just be more productive? Yeah.
Okay, I think I can speak to this in terms of the mindfulness bubble, because there's been this movement around if you practice mindfulness and do meditation more, especially at work, they've built these into a lot of different startups and things like that, that the idea that you can end up getting more done, being more effective, and so the crux is that you're now filling your time more, even though this is supposed to be a wellness thing. So I think that's one way. I think where we have been thinking about this outside the box is that it's not just around, say, mindfulness to be more productive. Like, I guess the staff I was mentioning around working on workplace wellness, like the goal is not for them to work harder and longer just because they have the capacity to, but more to help them start realizing their own emotions, their own behaviors, tensions, whatever it is that's there. So that's a piece where if you start looking at, again, like just developing a technology, you need to understand what's effective. And so when you start digging down into mindfulness, it's just one type of meditation. And so you can start thinking about different types of meditation that you can use and leverage technology for that are more focused on, say, like compassion meditation, which has been shown to be more effective in terms of well-being versus mindfulness is more effective in terms of focus. And so that's one way I've thought about this, because, yeah, the idea is that we're not just giving people tools that are technology tools to help them be more, we want them to be more productive and make less mistakes and all of those things. But the idea is that they're also doing something for themselves. It's putting your own air mask on before you help others.
So that's interesting, because I was also drawn to sort of the mindfulness and meditation and VR work that we're doing with the National Mental Health Innovation Center, but for a different reason, right? Like, when I've been thinking about this, I've been thinking, you know what technology is not improving on? A practice that people have been doing for thousands of years, right? Like meditation, and right, we believe that that's good. I'm not sure that technology makes that better, but it might make it more interesting to people who haven't tried it, or more sticky around like, oh, I'm gonna keep it up and do the work to practice meditation. And maybe I wouldn't do it if I didn't have this cool headset making it interesting. And maybe, so this is where, you know, our current sort of initiative comes in, maybe when we offer that experience through the Mental Health Center of Denver, right, it becomes part of an extraordinary experience we want to offer to people receiving services, right? And they come in not just for the meditation, right, and practicing that, but they also then visit their psychiatrist or work with their case manager to find housing or, you know, stable food, or they work with our healthy living program, right? So it's about, I think technology has the opportunity to translate things that people know work and bring it into sort of our current digital fast-paced lives that people find they have a hard time taking care of themselves in.
Great.
And I would add that, how many of you have an iPhone or an Apple Watch? Maybe a couple, right? It's the simplicity of the technology and how it relates to you. I think the Apple Watch and the heart rate monitor is one of the most exciting innovations when it comes to your own health and wellness, to be able to monitor and track your heart rate as well as wellness. And I would challenge this group to think of that kind of technology for knowing more about your health and wellness, specifically if you have a spike in a certain level or a blood glucose level that you can monitor on your own that would relate to you and say, maybe you need to take a day off from work today. You're carrying too much stress level. So I think it's the simplicity of the technology and how can we make it similar to the Apple Watch. You know, we can download our health records now into our iPhone, but where's that mental health component that we can really leverage and use more easily versus Candy Crush or playing Pokemon Go? There's a lot of great ways that we can leverage our cell phones, as KP had mentioned earlier in his talk.
So
I think-
go ahead.
Go ahead.
No, KP, go
I
ahead.
just have one thought I wanted, might be like a slightly different framing, but I think some of it is, how much of it is human behavior versus the technology, right? So I think one of the things that's going on in the technology space is that technologists want you to use their application. And one of the things that I think consumers are becoming somewhere between wary to angry about is how coercive technology is. So you ask yourself, well, is it the technology that's coercive? Is it the person? Really what the technology is doing is it's facilitating human behavior, like app notifications. It's kind of like email and addiction, right? Like really, if you look at it, like the thing that makes us like look at our email all the time, like that spontaneity of like never knowing what's coming next, is feeding into something in our brains, which is similar to what triggers addictive behavior, right? And so there's this interesting interplay between technology just as a platform and people and how we interact with it. And so like, because one thing I was thinking about as you asked this question was about authentic connection. So like, you know, when we think about well-being, and you talked about a really nice statistic about when, you know, individuals that are connected to people, they fare better in terms of their overall well-being. And so I'm thinking to myself, well, can technology facilitate more authentic interaction? And then I ask myself, is that a technology issue or a human issue?
Great. So some people say that the future is here. It's just unevenly distributed. So you talked about the Apple Watch, which I believe not everybody in Denver has access to. So these technologies and innovations that we come up with, how do we fairly distribute those, and how do we make them available to anybody regardless of what their income level might be?
And then I think it goes to the so what. So if they don't have access to an Apple Watch, do they need housing? And thinking through what would be the most benefit to that person from that whole person's social level. So if someone is at the level where they can't afford an Apple Watch and they're constantly on the street or they're making kind of ends meet, I think there's a bigger issue versus making sure everybody has an Apple Watch.
Yeah, and I think like there are some choices in how we go about this sort of health innovation work that we can make, right? Like, so let's take telehealth for an example, right? With telehealth, like, so I'm not afraid to admit it. Like, I'm in therapy, and this morning I had a telehealth session with my therapist, right? And it was helpful because we talked a little bit about this, right?
Underline that part. It's helpful. This is good. We're on the continuum.
Right, but you know, I did that session like from my house that has Comcast high-speed internet, and it has a computer, you know, a nice big, 27-inch monitor, and like it's, you know, I have the privilege to have a room that I can, you know, a private room I can do this in, or in fact a house, right, that I can conduct this therapy session in there. And so if our telehealth initiatives, if we use telehealth to sort of reach people, but force people to, you know, have all these things to have the other end of it, right, we are widening the healthcare gap, right? And we can use basically the same technologies, and this is, I think, what some of the rest of you have highlighted is it's not strictly about the technology, but how it works with people, to narrow that same gap, right? So one of the ideas that we are talking about executing here in our innovation lab, and we're another audience member I want to point out, Rachel Dixon with Prime Health is working with us on this, is putting telehealth kiosks throughout Denver, right? And so this is a platform like a phone booth or like a TARDIS, right? Like where people can come in and you don't need any equipment. You don't need to be living near a place where we currently provide services. And we have 40 locations throughout the city, and I think 5 or 6 primary sort of clinical facilities where people can walk in and receive services, but there are 77 neighborhoods in Denver, right? So we're not reaching everyone, and we know that. And so that's just an example of how we can take essentially the same technology, telehealth, and in one solution use it to widen health inequities, and another narrow the gap.
Another interesting scenario that many of you may be paying attention to, particularly if you have kids, is about this issue of screen time, right? So in terms of digital divide, this is another interesting scenario in terms of how it's played out. Because at first, the digital divide looked like affluent people had access and people without means didn't. Then as the cost of mobile phones and computers decreased, particularly in the school context, then there was a push to say every kid in every school should have access to a computer. Then, more recently, they found all the affluent people were sending their kids to schools without computers, because now it's showing screen time is a negative thing. And the World Health Organization just came out with a report, standards on screen time, just within the last 2 weeks. So I think the digital divide also becomes really interesting when it plays in these kind of counterintuitive ways.
So is there a role for technology and parents being able to advocate for the health of their children?
Yeah, I mean, I think there's one particular tech company that we're working with who was actually here tonight and may still be here, but Manatee's trying to develop a tool that increases both communication between the kid and the parent and create more real-time type of communication. So if a child completes a goal, the parent gets alerted and can then respond to that. And so you start reinforcing, and the child can see what they're working towards. And then in addition to that, building on a provider portal so that now you don't just have parent report or child report or probably lack of report, because usually they lose the sheet as soon as they leave the office that's supposed to be tracking their goals they're setting that week. I mean, I think tools like that are phenomenal in terms of being able to help parents and kids. And then I guess the other thing is we've been talking about kind of a web-based tool around even just helping kids start to understand their emotions more, and how do you talk to kids about emotions. And as we were talking to a group about this who was giving us input, one of them paused and said, gosh, I want my son to use this, and starts talking about how their son throws these tantrums, and they're epic tantrums. And so, I mean, I think right now this is where, it's not a passive, I think a lot of times we think of technology as passive, of hand the kid the phone and then they'll just watch something, right? And I think we can think of technology as another tool to engage and be active with your child.
Okay, great. So a last question is, Mike had talked about patients being a part of Catalyst. So how do you suggest we incorporate the folks that are going to be actually using the devices in the design of the devices?
Involve them? I would think that what we're learning from our consumer engagement work is to involve them and involve them early in the process, whether it's doing surveys or even just testing the model. But I think the tricky piece is, whether it's market research or not, there's a behavior change to that. So in this setting, they may really appreciate the virtual reality or the new shiny object, but when it comes to, will you actually make the behavior change? Will you use that? I think that's a different kind of study and partnership.
So I agree with involvement, and one of the things that I think, Karl, you brought to Mental Health Center of Denver is sort of design thinking and human-centered design principles, right? Which involve, it's basically just talking to people though, right? And like checking it out and not spending, a year building something with sort of because you think it's a good idea, but rather coming up with a quick prototype, testing it and seeing how it does. And I think those principles, remembering them and sort of infusing that into how we do our work and thinking I can't remember who it was here tonight mentioned this, but the way innovation works is you don't know exactly how it's going to play out, right? And so running short experiments and asking people for input is how that works.
Great. So I will stop on time, but just like psychotherapy, the most important questions come at the very end. So you get another couple of questions here. So I'll wrap up my remarks more quickly. So what are the promises or drawbacks of collaborating with big tech spaces like Google?
So I report to the Lieutenant Governor, and we have a health cabinet that's steering the state, and our Chief Innovation Officer and Chief Information Officer, they're part of that, and there was just discussion about the role of the state and how you leverage Google, especially within your Google search, and if we could, the discussion was if you could save one life by triggering a government pop-up, if somebody says, death by chocolate cake, if it just triggering the right word set. And I think that's a big question to think about, is kind of role of government, role of safety net in your Google searches and how that powerful engine. And then as a consumer, knowing where my data is going and who has access to it, I think is also top of mind.
I think from our perspective as a digital health company, on the one hand, groups like Google have a lot of scale and a lot of access to information that can help you understand what's going on with people. At the same time, they tend not to be as agile, getting to Wes's point, because a lot of what we do as well is, is human-centered design at the beginning, but also through the process. So running those micro experiments, constantly doing qualitative analysis. You find sometimes with the bigger shops, they're really pushing to scale fast, and they might have less of an inclination to work at that micro level. But I think state can kind of facilitate that as well as a proxy, kind of facilitating that engagement between, let's say, digital health innovators and groups like Google to contextualize it.
Okay, so I love this question. This will be the last question. What can the everyday, ordinary resident of Denver do to help make a difference? I don't believe we have any ordinary residents, but.
Well, so, I think this is gonna be a little incomplete because I have to admit that I have not completed the course, but I've started it twice. And so here I am making a public commitment, yes. So one of the things that you introduced to us at the Mental Health Center in Denver that I'm a firm believer is the Science of Wellbeing course. And I think Karl's going to talk a little bit about that on the slide that he sort of gave you a sneak preview of earlier while he was working his way around the clicker. And what I would say is, tell your friends to take this course. Tell your friends about it. I told my sister about it, and you know which Williams child has taken this course? The other Williams child, right? But I think you can do that. I think you can communicate these ideas of how to be healthy and make us all better.
Great.
Yeah, go ahead.
No.
I was just going to say, as most people I work with know, I'm obsessed with podcasts and apps in different ways I think part of it is just educating yourself about what the current state is and what's happening. So then you do know how you can be more proactive in contributing. But I think there's so many great, especially mental health, mindfulness, you name it, types of podcasts out there that can just help you understand the current kind of climate and what are the issues, because I think part of the time we kind of don't even know where to start, and so that can help you kind of identify an area that you're more passionate about.
Say, get involved with your local government, your community organizations, and just tell them what matters to you from a mental health and community perspective, because I think you all have a very strong voice, and use that to your advantage and just keep at it. And if you've got ideas, I think they are all very willing to listen and work with you. And there's a few more days of legislative session, so if you're kind of following it along, there's still an opportunity to influence some really important bills that are moving forward right now.
I mean, I'm, to the extent that people can, because I understand context matters, just to the best of each person's ability, try to advocate for your needs, because like a lot of what we're trying to do is, you know, build that movement from the bottom up as well, because that's part of what changes the system. And I know for some people they may not be in a position to, so at least for those of us that are and we can, that's part of how things will change, is we got to push from the bottom up.
Great. Let's thank our panel. And you guys can just sit here while I finish up, because your well-being's good. So a part of the science of well-being is there are different elements of what contributes to your well-being. It's called the Perma Model, and it stands for positive emotions. The more positive emotions you have, the more you will have, and there's a balance. If you're at 1-to-1, you're not doing so good, positive to negative. If you're more than negative to positive, then that's even worse. But if you get a ratio about 3-to-1, you're actually thriving. And there are things that you can do around positive emotions. So as I go through these, I want you to think if you had any of these events happen to you tonight. Engagement is that thing where you're so involved in something that time just kind of disappears. It's a subjective thing, but it is something that the more we're engaged in, it contributes to our well-being. So I got into the infinity box over there, right? Wow, talk about engaging. So relationships, positive relationships, the more you have in your life, the more you will have in your life. And positive relationships, when we're talking about well-being, has a ripple effect. Doing something meaningful in your life. I think you guys did a meaningful thing here tonight because you showed up, you're curious, you wanted to find out about things and make connections. And then if you accomplish things, it can be big things or little things, those are the things that will contribute to your well-being. So you can learn more about all of this. The most popular course at Yale ever in the history, the 316-year history of Yale, is the Science of Wellbeing course. It's online for free. There are cards you can pick up at the desk that tell you how to connect with it. You measure your well-being before and after. It's 10 weeks long. It takes an hour or two a week. There are videos that you watch. Dr. Lori Santos put this course together. She teaches it in front of Yale students that ask really good questions. You measure your well-being before and after. My well-being was really good before. It was measurably different after. Now here's the thing. I've told many, many people about this, and there are 3 responses. That's a good idea. I'll sign up someday, and they don't. There's the folks that start it but don't quite finish it. And then the folks that actually go through and finish it, to a person, they've said thank you. So I really encourage you to do that. It'll be great for our city if you do. And then the last thing is about how to get involved with us. I'm really thankful that people came to this space to interact and to sort of envision what might be in our future. Your perspectives are highly important. Diverse perspectives get better outcomes. So you will be getting an email from my staff later in the week on how you might be involved. And for that, I want to thank you for coming.